Hello guys, welcome to my YouTube channel Rapid Mate. Let's start our topic without any further ado. The title of our topic is cellular death. In it we will discuss our necrosis and apoptosis. Now, what is the morphological hallmark of cell death? It is the loss of nucleus, which occur by three processes. The first one is pycnosis, after that karyoexis takes place, after that dissolution takes place. Then what do you mean by pycnosis? Pycnosis means nuclear condensation. What do you mean by karyoexis? It means fragmentation. And after that dissolution occur, it means karyolysis. There are two mechanisms by which cell death occur. It is apoptosis and necrosis. Let's first talk about necrosis, then we will go towards apoptosis. What do you mean by necrosis? Necrosis means death of large group of cells followed by acute inflammation. And it is always due to some underlying pathological process. It is never physiology. And the important thing is, we have to note that it is always followed by inflammation, but apoptosis is never followed by inflammation because apoptosis is programmed cell death. We will talk about apoptosis later. Now, first let's talk about the types of necrosis. There are cross pattern of necrosis. The first topic of necrosis which we are going to talk about is coagulative necrosis. Now, necrotic tissue that remains firm, that means cell shape and organ structure are preserved by coagulation of protein, but the nucleus disappear because we are talking about cell death, and I have already told you that in cell death the nucleus disappear, but the cell structure, shape and size will remain same because there is coagulation of protein. Okay, and it is a characteristic of ischemic infection of any organ. In ischemic infection of any organ except brain, there is coagulative necrosis because in brain there is microglia cell which produce some lactic enzyme, due to which liquefatic necrosis occur. In brain, liquefatic necrosis occur, except that in other ischemic infection of organ there is always coagulative necrosis. Area of infected tissue is often wedge shape, pointing to focus of vascular occlusion. Okay, and it is in pale shape. And what I mean by wedge shape is like this wedge shape. Let's assume if there is thrombus in this artery, then the blood supply will not go to this area, then this area gets infected, so it is wedge shape. We can also see here wedge shape infection. Red infection, there is a term called red infection. What do you mean by it? It arises if blood re-enter a loosely organized tissue. Example of that is pulmonary and testicular infection. It is the loosely organized tissue, so if blood re-enter in that area, then red infection occur. Now let's talk about liquefied necrosis. And necrotic tissue that become liquefied, which is due to enzymatic lysis of cell and protein. Liquefied necrosis characteristically occur in brain abscess and pancreatitis. In brain, the hydrolytic enzymes from microglia cell liquefy the brain. In abscess, proteolytic enzyme from neutrophil liquefy tissue. In pancreatitis, proteolytic enzyme from pancreas liquefy parenchyma. Now let's go to gangrenous necrosis. Coagulative necrosis that resembles mummified tissue, which is also can be called dry gangrene. Okay, and if it gets superimposed with infection, then liquefied necrosis occur, which we call wet gangrene. Gangrenous necrosis characteristically occur in lower limb and GI tract. Okay, and GI tract. Let's go to caseous necrosis. The soft and pliable necrotic tissue with cottage cheese appearance. Okay, it looks like cottage cheese appearance. It is very soft and pliable necrotic tissue. We can also call it the combination of coagulative and liquefatic necrosis. It characteristically shows granulomatosis inflammation. It mostly caused due to tuberculosis or fungal infection. Let's talk about fat necrosis. Necrotic adipose tissue with chalky white appearance due to deposition of calcium. It is characteristically occur in trauma of fat, like in breast trauma, and there is fat in around the pancreas, which is called peripancreatic fat. So in pancreatitis also there can be fat necrosis too. And There is another necrosis which also occur in pancreatitis. We have read about it. It is liquefative necrosis. The fatty acid released by trauma or lipase join with calcium via a process called saponification. And saponification is an example of dystrophic calcification. Now let's talk about what is dystrophic calcification. In dystrophic calcification, the necrotic tissue acts as a nidus for calcification in the setting of normal serum calcium and phosphate. In it, calcium deposits on dead tissue. But it's not like metastatic calcification. In metastatic calcification, there is increase in calcium and phosphate, and the deposition of calcium occurs in normal tissue. Like in the example is hyperparathyroidism. If there is hyperparathyroidism, then there is high amount of calcium in the blood. Then it gets deposited on kidney. Due to it, there is nephrocalcinosis. Let's talk about fibrinoid necrosis. Necrotic damage to blood vessel wall. In it, there is necrotic damage to blood vessel wall, and due to leakage of protein into vessel wall, there is bright pink staining of wall microscopically. It is characteristically seen in malignant hypertension and vasculitis. Now let's talk about our another main topic, apoptosis. In it, energy-dependent genetically programmed cell death involving single cell or small group of cell. Then it is known as apoptosis. The example are endometrial shedding during menstrual cycle, removal of cell during embryogenesis. There is formation and removal of cell during embryogenesis. Like the first, our hand look like this. Later there is apoptosis and our fingers get separated like this. The tissue between the fingers get apoptotically removed. So in embryogenesis also apoptosis occur. And another example is CD8 T cell, CD8 positive T cell mediated killing of virally infected cells. Morphology. Then now let's talk about morphology. The dying cell shrinks, leading cytoplasm to become more eosinophilic. It's also become pink microscopically. Nucleus condenses and fragment in an organized manner. The apoptotic bodies fall from the cell and are removed by macrophages. Apoptosis is not followed by inflammation. Unlike necrosis, necrosis is always followed by inflammation. And apoptosis is mediated by caspases that activate proteases and endonucleases. Proteases break down the cytoskeleton, endonucleases break down DNA. The caspases are activated by multiple pathways. There are multiple pathways by which caspases are activated. One of them is intrinsic mitochondrial pathway. Cellular injury, DNA injury, or decreased hormonal stimulation also leads to inactivation of BCL2. BCL is a protein which regulates the process called apoptosis. Okay. And lack of BCL2 also allows cytochrome C to leak from the inner mitochondrial matrix. Cytochrome C released from inner mitochondrial matrix, and it goes into cytoplasm. And due to it, there is again activation of caspases. There is another pathway, extrinsic receptor ligand pathway. In this fast ligand bind fast death receptor on the target cell, activating caspases. Example is negative selection of thymocyte in thymus. And tumor necrosis factor binds tumor necrosis factor receptor on the target cell. It also activates caspases. Cytotoxic CD8 positive T cell mediated pathway. This is another pathway. Cytotoxic CD8 positive T cell mediated pathway. Porphyrin secreted by CD8 positive cell creates pores in the membrane of target cell. Let's assume this is a target cell. Then porphyrin is secreted by CD8 positive T cell. Then there is pore formation in the membrane. Due to which again the cytoplasmic materials get leaked into the interstitial space. Due to which caspase again activates. And granzymes from CD8 positive T cell enter pores and activate caspase. CD8 positive T cell killing of virally infected cells also. Thank you guys to support me. Like, share, subscribe and comment on my YouTube channel. Thank you.